Hi, I'm Dr. Chant.
And I'm Dr. Taryn, and we're chiropractic physicians at Copperwell Chiropractic, and we have teamed up with Shield Safety to teach you how to use your new tools.
The information you're about to receive is amazing, and it will save you a lot of money, and we're here to teach you how to use the tools you got from Shield Safety properly. One of the tools you received is a tuning fork. Now on the fork, you want to make sure that you hold the leg of the fork, that way you won't interrupt the vibration when you place it in the spots to check for the fractures.
The second piece of equipment you received was your stethoscope. Now the stethoscope, there's important things you need to remember. When using the earpieces, slightly tilt them out, and when you put them in your ears, this part is going to be facing forward. With the angle of them, they are going to be better fitted into your ear canal and allow you to hear properly. The other important thing to remember is the bell and diaphragm of the stethoscope. When you're listening for the fractures, it's important to use what's called the bell side or the open side. To know that you're activated on the bell, there's an indicator. This one has a green dot, and that green dot should be facing towards the bell. When it is, you will know that you are listening with the bell.
Well, this is a very useful tool. We want to make sure that if you have any doubt about an injury, that you seek medical attention. Now these tools, and what we're going to teach you today, is going to be very useful in emergency situations such as disasters. I'm going to demonstrate on my daughter Bryn first.
Hi.
She actually did break her arm, and it broke right here, and I didn't have these tools or the knowledge of how to check. We were kind of away from a hospital, and I wish I had that. So I'm here to stress to the parents how powerful this tool really can be to help. Alright, so you want to make sure, again, that these are faced down or outward away from you before you place them in. You want to place the bell of the stethoscope on her elbow, right here. Then you grab the tuning fork, make sure that you have it by the leg. You can bang it against your leg or your knee to get the vibration going. And then you place it on the inside, and you can hear like a sound is what you should hear. And then check the other bone in the arm on the other side. Okay, this is my other daughter, Ainsley. Can you say hi?
Hi.
We're going to demonstrate how to check for fractures in the lower leg. You want to place the bell right on the kneecap, right there. Now again, only grab the leg of the fork, hit it against something stable, your leg, your knee works just great. And then you want to place it against the ankle, and you'll hear that humming sound. You want to check both sides to see if you hear that sound. Okay, we want to tell you that the bones in kids are more flexible, and so that vibration might get lost in the flexibility of the bone, whereas adult bones are hard and you can hear that sound more readily. So with your child, they may be in a lot of pain, but take the time to check the good leg first to kind of see what that sound should sound like on a healthy bone in their body.
Now that Dr. Chant has used his children to show you how to check for fractures, it's important to remember that you can do the exact same tests on an adult. The difference here is child bones are a little softer and a little more flexible, like Chant explained. So when you're doing it on an adult, still listen and use that sense, but also go for more of a feel as well as pain on the actual patient. Melissa here is going to let us demonstrate on her hand. It's important, again, always keep those earpieces facing away from you so they fit properly in your ear canal. You're going to ask your patients to always remove jewelry, and if you can, go skin on skin. Using your stethoscope, make sure you use the bell, and you're going to place it on each finger. You're going to activate your tuning fork, and you're going to listen at each finger. While you are still listening for that humming sound, you're also going to feel your patient, and if she's pulling away, if she's saying it hurts, there's a good chance that it's a fracture, even if you hear the humming sound. It's also important that you can check several sites by checking farther away and on each knuckle to give you more of a chance to catch a fracture through the whole hand and finger. In elderly, one of the most common fractures is the neck of your leg bone. Melissa here is a little too young for this fracture, but we're going to show you how to look at it anyway. Again, keep your stethoscope pointed away from your ears. You are going to ask your patient to feel the bone on the front of her hip. Once she finds the bone, place the bell exactly on that bone. You're going to then activate your tuning fork and place it on the kneecap. While listening here, we'll let you hear the entire leg as well as the neck, which is the most common elderly fracture. If you then place your bell on the side of the leg bone, if you feel it, you can feel a nice little bump where the bone is. Place that bell on the bone and continue listening through the kneecap, and that will isolate more of the thigh bone and take away that neck fracture, which would be a more common break on someone Melissa's age versus an elderly patient. Now we're going to demonstrate how to check for fractures on an adult foot. In children, their bones don't just appear overnight, they slowly develop over the years. So this test may not work on a child because the bones may not be formed yet. You'll be able to listen to each bone, as well as if there is a fracture, it will more likely hurt the patient. So to start, place the bell on the end of each toe and activate your tuning fork. You're going to listen in a straight line from toe to toe. As well as checking multiple sites along the foot. Because an adult, it can be harder to hear through the hands and feet. So you want to go more on the feel towards the patient with the actual tuning fork. And the patient, if there is a fracture that a tuning fork can identify, it will hurt and they'll want to move their foot away from you.
Just saw the demonstrations of how to test for fractures. And I'm telling you, as a parent, I've had 2 fractures in my family, and I wish I would have had it with me when I knew this information when that happened, because it would have helped us out a lot. So, really, we practice a lot in school. We're doctors, we understand that. But listen, you have the tools now, so practice. Take it out. Don't just take it out when it's time to test. Play with it. Your kids will love it. It's a fun vibration sound. It tickles a little bit, and just have fun with it.
And remember, all the tests you saw Chant do on his gorgeous little daughters, you can also do on adults. So go out, get your significant other, take it to the bar with you, and see what you can hear.